Are fatty cuts of meat linked to an increased risk of dementia? In recent discussions about diet and brain health, one question has emerged. Are fatty cuts of meat linked to an increased risk of dementia? With growing interest in nutrition's impact on cognitive function, many are eager for answers. Just earlier this week, new research has sparked conversations around dietary choices and their effects on mental well-being. If you are curious about how your food choices might affect your brain, you are not alone. Let's break down what current studies say. Current research does not directly connect fatty cuts of meat to an increased risk of dementia. However, there are related findings that offer some context. Processed meats have been linked to a higher risk of dementia. One study revealed that consuming a lot of processed meat can increase dementia risk by about 13%. This suggests that limiting processed meat intake may be beneficial for brain health. Diets focusing on brain-friendly foods such as nuts, legumes, fish, and healthy oils have shown protective effects against dementia. The MIND diet combines elements of the Mediterranean and DASH diets. This diet is associated with a 9% lower risk of dementia. It emphasizes plant-based foods, whole grains, and fish rather than red or fatty meats. At a biochemical level, brain damage related to dementia involves oxidative stress and lipid peroxidation. This refers to damage to fatty components of brain cell membranes. Research indicates that increased iron in the brain can drive oxidative damage to lipids, contributing to cell death and the progression of Alzheimer's disease. This process involves lipid rafts, which are fatty parts of brain cell membranes that regulate important proteins linked to dementia. When it comes to fats, omega-3 fatty acids found in fish are considered beneficial for slowing dementia progression. However, more research is needed in this area. This contrasts with concerns about saturated fats found in some fatty meats. Yet, direct evidence linking fatty meat consumption to dementia risk remains limited. Vitamin B12, commonly found in animal products including meat, is vital for brain health. Low active levels of vitamin B12 have been linked to slower cognitive processing and brain lesions associated with dementia. This suggests that adequate intake of vitamin B12 from meat or supplements may support cognitive function. While processed meats are linked to increased dementia risk, there is no clear evidence that fatty cuts of processed meat directly increase dementia risk. Brain health appears to benefit more from diets rich in fish, nuts, and plant foods, along with adequate vitamin B12. The carnivore diet, which emphasizes meat consumption, would need to consider these factors carefully, especially the type of meat and nutrient balance, to avoid potential negative effects on cognitive health.